everybody, welcome back to my YouTube channel. So in this video, I want to give my opinion and my answer about the case studies 16. Therefore, let me introduce myself. My name is Jhennifer Bergita with name 222010. Let's start. I agree that the hospital must continue to pay attention to the values regarding AIDS families' beliefs by not carrying out blood transfusion. But that doesn't mean that by not having a blood transfusion, the patient's life cannot be saved. A doctor's primary professional duty to try to benefit his patient's health is to try to save his patient's life, when and if doing so would benefit his patient's health. Of course, this is not an absolute duty that overrides all other duties, especially if the patient is independent enough to refuse life-prolonging treatment, as was the case with A and his family, who refused treatment with blood transfusion. But doctors generally have to accept the request, however painful it may be for the doctor to agree. The hospital must try again to find another solution that takes into account the patient's condition, but still pay attention to the values of belief. Likewise, vice versa with family A. It is not appropriate to only immediately pay attention to family A's opinion from only one point of view. The family must not be selfish, because this condition concerns the safety of A lives. The medical community itself has a developed view when faced with treatment that requires avoiding transfusion or non-blood treatment. According to a medical education journal, it states that many of the techniques developed for use on Jehovah's Witness patients will become standard practice in the next few years. In another article, it is also stated that bloodless surgery should not only be used for Jehovah's Witness, but should become an inseparable part of daily surgical practice. Thousands of doctors around the world now use blood conservation techniques to perform complex surgeries without transfusion. Such blood transfusion alternatives are used even in developing countries and are requested by many non-witness patients. Bloodless medicine is a popular concept in many American hospitals. It refers to all strategies that can be used to provide medical care without allogeneic red blood cell transfusion, including blood conservation. Bloodless treatment begins before surgery. Among the possible strategies in preoperative period, the use of erythropoietin and iron supplementation to optimize preoperative hemoglobin levels. Collection of autologous donations to prevent allogenic transfusion. Avoidance of any drugs that increase the risk of bleeding, including herbal remedies like garlic, ginseng, ginger, and optimal control of existing coagulation disorders before surgery should be considered. During surgery, maximum attention should be paid to limiting blood loss and ensuring good hemostasis and rapid control of any bleeding. Only non-blood surgical alternatives are the right solution for ACE condition, ACE family, and also the hospital. So that's all for me. Thank you.